7, and you do 1.
My name is Elizabeth Roxas-Dobrish. I am former dancer of Alvin Ailey American Dance Theater. I teach now at the Ailey School. One day, I was teaching class, and I put my leg in one of those figure 4 movements, and I sank on that hip, and I felt my hip pop. And then slowly, progressively, it became worse and worse until the point that I could not literally walk from where we're sitting to the door. So finally, I asked my friend, she was also a former dancer with Ailey Company, and she went to see Dr. Su. And she basically said to me, Liz, there's no one else to see, go straight to Dr. Su.
So Elizabeth's diagnosis was hip arthritis with some dysplasia. Hip dysplasia refers to the shape of the socket. So her socket doesn't fully cover her ball like it should, and that leads to increased forces right in this area of the hip joint.
And Dr. Su knew that I still wanted to continue to teach and I wanted to be agile.
She told me that motion was extremely important to her and she was very flexible. So it was important for me to consider these things in selecting the surgery. We decided on performing hip replacement surgery through an anterior approach. So anterior approach to the hip means that we come from the front. Most surgeries in the United States are done from posterior or through the side or the back side, but we're starting to see some data that suggests that their recoveries may be a little bit faster and that their joint may be more stable. So for somebody like Elizabeth, it could create a stable joint that allows her to have high ranges of motion. This is the operation we did, which was the hip replacement done through an anterior approach. So she's got her titanium pieces now attached to her bone, and by carving out a new space with this metal socket, we've corrected the dysplasia so that she no longer has that problem.
Yeah, take your time, right? Did you see his phrasing?
And it was almost instantaneous, no pain. It was amazing. And I must say that HSS, the hospital, I felt like I was in a hotel. Really, I mean the service and the care and just everything from beginning to end. I had an incredible experience. Actually, the Ailey organization asked me to do revelations. And I said, you gotta be kidding me. You're kidding me, right? I mean, you know I had a total hip replacement. I went to Dr. Su before I really said yes to ask him, Dr. Su, am I really being realistic about this?
And when we evaluated her and checked her motion and her strength, I said go for it.
He was so positive. He said, I know you can do it. That's what actually propelled me to really take classes again.
And she really, through hard work, determination, and her physical ability, she was able to accomplish that.
Given a goal, and given that determination and the will, I think it's possible.
It's an incredible feeling. So that's why I come to work every day and look forward to coming to work and being able to help people and bring them back to their dreams and passions.